Good morning, everyone. I am Roslyn Anita, nursing tutor in Tribulum College of Nursing. Today, I am going to present the topic on upper gastrointestinal endoscopy. Objectives: Introduction, definition of endoscopy, list down the purposes of endoscopy, enlist the indication of endoscopy, discuss the principles of endoscopy, list the articles needed for endoscopy, preparation of patient for endoscopy, explain the procedure of endoscopy, list the post-procedure care of endoscopy, enlist the complication of endoscopy. Introduction. Upper endoscopy is a procedure used to visually examine upper digestive system with a tiny camera on the end of a long flexible tube. A specialist in disease of the digestive system, gastroenterologist, uses an endoscopy to diagnose and treat conditions that affect the esophagus, stomach, and beginning of the small intestine, duodenum. Unlike many other medical imaging techniques, endoscopes are inserted directly into the organs. Coming to definition, the endoscopy procedure uses an endoscope to examine the interior of a hollow organ or cavity of the body to visualize the esophagus, stomach, and duodenum by a flexible endoscope that permits biopsy, cytology study, pictures, and video documentation. Purposes: to perform biopsy, to remove polyps and foreign bodies, to control bleeding, to open stitches. Indications: chronic GI bleeding, pernicious anemia, esophageal injury, masses in GI tract, stitches, dysphagia, epigastric discomfort, neoplasms, ulcer in upper GI tract, esophageal and gastric varices, gastroesophageal reflux diseases. Overview of the endoscopy. The whole system for GI endoscopy, including the fiber optic scope with embedded camera, monitor, keyboard, video recorder, and photo printer system. This is the overview of endoscopy. UGI parts. We'll see one by one. That is video camera, deflection control knobs, suction valve, air water valve, instrument pot, distal tip, suction connector, insertion tube, video connector, air pipe, light guide, electrical contact. These are the parts of endoscopy. Principles: fiber optic endoscopes use bundles of thin glass fibers to transmit light to and from the organ being viewed. This fibers uses the principle of total internal reflection to transmit almost 100% of the light entering one end to the other end. Articles needed for endoscopy procedure: endoscopy tray or trolley, suction equipment, resuscitation equipment, mouth guard, drugs as prescribed, syringes, needles, adhesive tape, lubricant jelly, gloves, gown and mask, specimen containers, slides, protective pad, and Macintosh. These are the articles needed for upper UGI scopy. Preparation of patient. First, you have to explain procedure to the patient. Some of the rationale are alleys anxiety and helps in obtaining cooperations, and get informed consent from patients, avoids medical legalities, and keep the patient NPO for 8 to 12 hours. Some of rationale are prevents aspiration of stomach contents into lungs and allow for complete visualization of the stomach. And next point is assess the oral cavity and report any lesions or loose tooth. If dentures are present, remove it. Dentures may cause obstruction during procedure, and removal of dentures facilitates passing the scope and preventing the injury. And next point is spray the throat with local anesthetic due to suppresses the gag reflexes. And next, intravenous sedative may be given. It provides sedation and relieves anxiety during procedures. Stop taking aspirin, non-steroidal anti-inflammatory one day prior. Wear loose, comfortable clothing. That gown we provided. Procedure. First point, position patient in left lateral during procedure. Due to left lateral position, facilitate the drainage of saliva and provides easy access for endoscope. And lubricate the endoscope with warm soluble jelly. Rationale is makes insertion easy and avoid friction. And explain that room will be cool and dark, and the patient will not be able to speak when the scope is in place. Rationally, allow patient to have realistic anticipation and reduce anxiety. Place the Macintosh below head and neck of the patient. Rationally, protect patient bed linen from soiling. And place the mouth guard in place. It prevents the patient from biting on scope. Instruct patient to swallow while endoscope is being advanced. Once inserted, instruct patient that he will not be allowed to swallow, talk or move the tongue. To gain cooperation during the procedure. Suction out and examine secretion from oral cavity as necessary. It will prevent the risk of aspirations. Monitor vital signs and oxygen saturation throughout the procedure. It helps in early identification of complications. And place the patient in Sims position. It prevents aspiration due to anesthetic effect. And coming to post-procedure care, continue NPO status until gag reflex returns. Provide lozenges or normal saline gargling. Assess for signs of esophageal or gastric perforations. Provide complete bed rest for 1 hour. And monitor patient for abdominal or chest pain, hematemesis, melena or distended abdomen, fever and lightheadedness. Monitor vital signs every 30 minutes for 3 to 4 hours and keep the patient in bed with side rails up. Record the procedure in nurse's record, including timing of the procedure, tolerance, and patient reaction. Complications: perforation of esophagus or stomach, pulmonary aspiration, hemorrhage, respiratory depression, infection, and cardiac arrhythmias. Ugescopy findings. This is a normal fundus. Stomach ulcer. This diagram shows the gastritis. This diagram shows the gastric cancer. This is the pancreatic pseudocyst. Coming to conclusion, endoscopy made the minimal blood loss surgery with increased rate of healing with less pain. Upper GI scopy is an effective and appropriate approach for initial investigation to assess patients with dysphagia. It enhances the early diagnosis and thus helps in early initiation of the required treatment for acute abdomen, including pharmacological and surgical treatment. Thank you.